Thank you very much, Chaz. I was talking to Rob over here just a moment ago. We were expecting you to break out in a rap song. With that hat and the mic and everything, just perfect. Is there karaoke later? I don't know. I heard something about fun in that first session earlier. So, welcome to the Wearable Tech panel. How many, raise your hand if you have a wearable on right now? Fitbit, Apple Watch. Yeah, excellent. Oura rings? Yeah, great. Who already has a question for the panel? Before we start, no? Okay, well, throughout this talk, make a note of your questions. We might leave some time for one or two. No promises. Because we have an excellent panel, and my esteemed panelists, if I can ask you to introduce yourself, starting with Susan.
Is this one? Yeah, there we go. Hi, everyone. I'm Susan Thomas. I'm director with Google Health here in the UK. I basically sit over all of our products related to health and make sure that we bring them to the NHS and the tech ecosystem in a consistent and coherent way. So that's me.
I'm Rob Milnes. I'm the CEO of VO HealthTech, and we have a women's wearable device, 2 different sensors. We've been on the market since 2016. And happy to share some of the interesting insights we've learned from the market.
Hi, my name is Kristina. I work at Oura as a product manager. Oura is a Finnish company doing a wearable that tracks your sleep, activity, and recovery. And I joined Oura about 2 years ago to set up women's health product development for the company. So it's still relatively new, but we're doing some great things and building new features designed for women with our team of data scientists, product designers, software developers, and different people from across the organization.
Hi everyone, my name is Mario, CEO and founder of HealthTech. I'm in health and wellness for over 10 years now, scaling international health and wellness businesses and apps to 250 million registered users worldwide. And now with HealthTech, really focusing on making glucose monitoring more accessible, more understandable and actionable for especially women.
Thank you. And my name is Caleb Parker. I'm the founder of Bold. I strongly believe that entrepreneurs make the world a better place by solving problems to improve the lives of people, and very proud to partner with FemTech to launch the world's first FemTech hub here in central London last year. So speaking of problems, we are at the Decoding Conference, and in order to decode the future of women's health, we have to decode the past. It was a phrase that Rob eloquently put in our pre-panel chat. So there's so much we don't know, and huge gaps to fill in education, as we heard earlier today from Dr. Helen. But what if we did know? And if we were to imagine a future where women had years of personalized data that they could refer to, how empowering would that be? What would that world look like? And that's the question I want to turn to Kristina first to talk about. What does that world look like?
Thanks, Caleb. I think, it would definitely change the narrative. It would empower women to have hard data, facts and figures through their wearable data on their bodies, not just their cycles, but about facts and figures about their entire bodies in the palm of their hands, where they could go to the GP and say, here's my cycle for the past 5 years. Take a look. This is undisputable. So it can be really empowering. It puts women to the driver's seat. And that makes all the difference, because then women can make more informed decisions on their bodies, and this way they can change the conversation. So wearable data can be really empowering, especially if you have it from a longer period of time.
We talked earlier last week about some of the different patterns that can be recognized. So, Susan, I want to bring you into the conversation. And how do you see this world looking?
Yeah, I think it's really interesting. We know that consumers want to be more in control of their health, right? Whether it's women, men, whoever, right? People want to have more control over their health, and data gives them that, right? And information from wearables. I think it's really important not to forget devices as well. Wearables are really important, but unless you can take that data from a wearable and turn it into something that's information and meaningful for you, then it's nothing, right? And the other facet of that is that here in the UK and in the US, wearables are really easy for us all to access. In low resource settings, much less so. So devices have a really important part to play in empowering people globally, but especially women globally, I think. I think the importance of giving, therefore, women that control and that information is huge, as you were just saying, in terms of being able to go to your GP and give that information and have a conversation where you're not in that sort of old world of sort of asymmetry of information where the GP or the doctor, often a man, has all the information and you're there trying to convince them of your symptoms. That's a whole shift, like a proper shift in how we interact with the health service. It allows us to keep ourselves well. It allows us to manage prevention differently all the way through. There's been some research done in Northern Ireland looking at elderly women who are having falls, and having a wearable to help manage their sort of activity and keep them active has had a dramatic impact on stopping them falling. So there's all sorts of uses by bringing a wearable into play that we can see. It's not just about menstrual health. It's not just about sleep and steps. It's about so much more than that.
Yeah, and as you said, I can't remember the name, but earlier in the panel, it is about being preventative and being proactive and being prepared with that data, because think about it, we women, we go through so much through our lives. We have different stages in our reproductive health journey. There's so much happening. There's so much to track. There's so much to understand. And with data, when you understand things, you can be more compassionate towards yourself and towards your body, and understand, oh, this is normal for me. This is not normal for me. This is okay for me, and this is normal in this stage in life. And I think that's also what we're lacking, and seeing that wearables can do, and that's like a major, powerful shift to us women going through all of these things.
It's a very good point. And I think if we think about the need for this data equaling the need for wearables, why now? The addressable market hasn't changed. We've had this problem for decades, right? We need the data for women. So the problem hasn't changed. So why now? Rob, what's causing this to become a focal point today?
Well, it's easy to forget that the phone that you carry around, that a lot of you are still using at this point in time, I can see, the phone that you carry around with you every day is a computer. And that really only started to happen in the mid-2010s. So we had a device that was a standalone device to begin with, that we then transferred into a digital health device, so the wearable spoke directly to the phone. But we weren't capable of doing that when the business set out in the early 2000s. And so one of the reasons is the tech had not got far enough for us to be able to understand it. The other thing is people just ignored it. And we heard a lot about that from the panels earlier today, but women's health was ignored for a very long time. It took until only about 10 years ago for the FDA to say that women had to be included on trials in the United States. And in fact, there was an edict in 1970 to prevent women from taking part in clinical trials, right? So one of the things we learned from the data that we were seeing, so we started out as a fertility device, and what we saw is that the vast majority of people using our device actually were using it to manage their condition, to understand what was going on for them, for their menstrual cycle. And from that, we learned that over 65% of them had PCOS. Many of them had a miscarriage risk. Many of them probably have endometriosis but haven't been diagnosed yet. And so we started to work on that data in a clinical setting to understand how we could help use that data both to screen for these issues in the first place and then to monitor for therapeutic intervention.
I also think about the fact that, like, when I was growing up, we were playing Atari. Is that okay to say? I don't know. Then we went to Nintendo, then we went to Game Boy, and then we went now to PlayStations and all this stuff. All the generations coming up today are used to playing with devices, and now people are used to wearing things. It's become an expectation. If I do this in my personal life, then why can't I do this in the rest of my life? So is there a generational part of the convergence of why now? Mario, do you have an opinion on this?
Yeah, I think in general there surely is. I mean, we are just growing up using technology, but also I think consumer tech has really traditionally been doing a really bad and a terrible job in instilling trust in technology. Right? It's really that double side of the same coin, where we always say technology can do good, technology can also do bad. But in that sense, I think when we look at our institutions, when we look at our legal foundations, how we looked at privacy for the past 8 years has really not met the minimum standard. Not even talking about enforcing those laws and those agreements that would help end consumers build that trust in technology. They are owning the data, they are owning the knowledge, they are owning the insight. And whenever the consumer chooses to share that information with the care provider, with the practitioner, obviously that's where it becomes super valuable. And instead, the systems really, misused health information for the past 9-10 years.
Susan?
Just building on that around data, we're going to be publishing some research that we've done in a few days. And that point comes across really clearly around the data side. Trust is hugely important, but interestingly, the vast majority of people don't mind sharing their data if they know they're going to get something back, right? If there's a transaction there that's valuable for them, they'll do it. As long as a sort of set of hurdle criteria in terms of privacy and so on are met, people are really willing to share their data. Now, I thought that was probably a shift. I've gone back and can't really find it. So I think the people who shout about sharing data are probably small and loud rather than many. But I think it's really important. And just one final thing. I've just been pinged by my Fitbit. I'm clearly having an autonomic reaction sitting here on the stage with a level of anxiety asking me to check in my stress management opinion. And you can all help me. Is it stressed, frustrated, worried, calm, content? I've gone for stressed, but in a nice way.
Hopefully not frustrated.
Not at all.
Yeah, and I think in the earlier panel I asked, how can we encourage more women to work in tech? I think we're seeing that. There are more women entering tech companies and building this and building products and services for women. But for Oura, for example, it was, it's a ring, right? It's not a chunky watch. Sorry, Apple. But it's more appealing to the female user, and this is what our, the feedback, what we're getting from our customers is that they're saying that I don't want to, sleep in a chunky watch. I'd rather use a ring that's more discreet. It goes well with my jewelry, and it's just like part of it's easily more integrated as part of my everyday life. So that's the form factor is one. But for Oura, it was about also, we were seeing that more women started to buy the ring. So our female audience grew and grew. And then our data scientists amazing group of people. They were looking at the data, doing their normal research for product. And you know, they discovered, you know, we have so much body temperature data. There's a cyclical variation, which we obviously knew, but then it was actually a group of women within the company who said that, hey, we should do something with this. And that's how our team got to build and launch the first, Oura's first women's health feature, period prediction, which has been super exciting, but we obviously still have a long way to go. And it also goes back to like female empowerment and this educational factor. And back to this body temp example, I gotta share this with you because how there's still this educational knowledge gap is what we have been hearing from our users is, okay, they have this smart ring. It tracks your body temperature with its sensors. You wear it every night, and then it tracks this and draws this beautiful line of your body temperature cyclical pattern throughout your month. And women, I talk to a lot of users because I work in product, and I always ask them for feedback, and they are telling us that I didn't know that my body temperature fluctuates throughout the month because of my menstrual cycle. And for them, this has been super empowering, super mind-blowing, but these are also like older users. And think about that for a while. It's like, holy shit, we got such a long way to go, but there is this empowerment happening through the wearable data, which is super positive, and it's spreading like wildfire. And that's, I think we're seeing more wearables taking up the space and more women and people buying them and having them and wearing them.
Good, excellent. I'm going to take a moment to see if there are any questions so far. Oh my goodness. I have time for one though, so how do we pick this? Wow. I saw you first actually, so you were fast. Sorry guys.
I hope it'll be worthwhile for everyone. I've been an Oura user for 3 years. I have over 1,000 days of data. I was using Oura before there was the women's health part, and then when it came, I started to notice the temperature part. I was really excited because it empowered me, because I knew that when the temperature went from plus 0.1 or plus something to minus, that I would wake up and in a few hours I would have my period. That was really empowering. Another thing I'm testing right now is looking at the day where the temperature switches from negative to positive and seeing if I can count 14 days and see if I'll be right. Still, that's not like perfect, but I'm working on it. What I would like to see is, I know, because I have also a background in managing data and statistics, and so I'm looking at my own data, and I know what my regular heart rate is, what my HRV is during my follicular phase, and I know what it is in my luteal phase. However, the algorithm doesn't distinguish between the two, and it doesn't know that whether I'm on day 2 or my HRV is day 22. I would like it to tell me this is abnormal for a day 22 for you. This is, you're doing great, because they're very different, those two times of the cycle. Furthermore, I would also like to see how Oura can develop a plan for how women can prepare for perimenopause. And so that's something I'm looking, and as Susan said, data doesn't matter if it's not going to be helpful to us and actionable. And so I'm looking to see how can I empower myself to get ahead of the inevitable changes that are coming and be able to be a better self-advocate for myself when I go to a doctor.
Well, thank you firstly for the user feedback. Great to hear. We hear that a lot, and that's exactly one of the reasons we built our team, right? Because unfortunately, sorry to say this, but this is a company where we have a lot of men. They are amazing, but the focus was elsewhere. And the feedback was very clear, because we had so many women using the ring, and they were like, hey, why isn't it picking up? Why is it bothering me about, hey, your body temp is a little bit high. Are you sure you're okay? Right? That's annoying. Like, this is normal for me. But I think that's the next step that we as a wearable company need to establish. It's not just about knowing your cycle and knowing your body, but it's offering like educational, contextual information and insights to your body, so you know what's normal for you and what is not normal, so you can really understand, like, hey, this is not right. And when you start to have that longer term data, the whole point is that it helps you be prepared what's coming. Not just what's coming as in, like, when's my next ovulation, when's my next period, but what's really coming, like something like pregnancy, for example, and heart rate, and seeing that, hey, this is really heavy for my body, I'm 6 months pregnant, still 3 months to go. You can expect your heart rate to be really high by the end of your pregnancy, or something like this. And again, having that information, it helps you, take breaks and be gentle towards your body. And I think for women, this is really going to be the key. But and as so many people have said here today, menopause is a massive opportunity. And I think one of the reasons we're not yet seeing that many, at least, tech-specific services or products designed for menopause is because we don't have 45 to 50-year-olds working in tech, enough of them building these solutions. So it's going to be the younger generations who are going towards perimenopause. And what I say to my friends, like, I want to be prepared when it comes. I want to know what it is. I want to be able to track stuff so I can actually compare that menopause is kicking in. This is how my body and my cycle was before, and now I can understand how it's starting to change. So again, it goes back to the data, but we hear you, we take your feedback seriously, and we hear it a lot from other users as well.
Thank you for that question. That was fantastic. And I think the question comes up, if we do move into a world where we have all this data and we can see the patterns, then, is FemTech, is wearable tech, does that become an ecosystem of collaboration or an ecosystem of competition? Hopefully not the latter. And often, particularly when some of the founders are fundraising, the investors will say, well, it's quite a very fragmented and overlapping market, when in fact, if you think about the travel industry as an analogy, in the travel industry, sure, airlines and trains and taxis compete, but the same person can be using all of the three on the same journey. So I imagine the same can be said here. So I want to talk about how do we create an ecosystem for collaboration so that data can be shared to empower women. And I'll start with you, Maria.
Caleb, that's a big question. But first one, I think when you said, the market size or the market opportunity when speaking with investors, and we heard this today before, Hello Insight had a bit of a funding challenge, to be honest, right? Because investors, all the big VCs are not understanding how big the market actually is. We're getting replies of, well, it's a niche market. How can it be a niche market? And so when looking at the development of the space, I think we've also come a long way. The past 10 years, we've seen many, many walled gardens because of obvious reasons. And I think when we look at a care pyramid, when we, for example, how we look at it from an Hello Insight perspective, that we do have general information available, one to many, essentially when we're talking about specific programs or knowledge content. That is amazing. But the layer on top is really then one to few when we talk about personalized insights, personalized recommendations. But really the top of the pyramid is then the one-on-one conversation that people would still have with the practitioner. And in there, from the level 2 to level 1 is, I think, the important part of relying on a resource to help you guide through which of the services, which of the tools, which data sets you should be including as part of your assessment. This is not something I see, for example, AI doing in the future, because it's so nuanced, there is so many different approaches in there that you need a human interaction on that. And this is exactly where just service providers like we need to make sure to keep users in the center and not talk about individual businesses, because the human metabolism is just hugely complex and we need to account for all of it without building walled gardens to truly transform and going back to changing the narrative.
Rob, do you have some thoughts on this?
Yeah, I mean, I think we mentioned devices earlier and the difference between devices and wearables. We're a Class 2 medical device. The hurdles that we have to climb in order to prove that our product works are considerably higher than for a device like Oura, and that's how it should be. But it's very important to understand that the data that you therefore gain in order to be able to market a product that's a Class 2 medical device is that much more certain, right? So I think it's very important that we don't see competition in the market, because theoretically I could walk into an investor tomorrow and they'll say, well, what about Oura and their cycle tracking? That happens all the time. The truth is, your device is generally great for women with what you might class as a normal cycle, or a regular cycle at least. There are over 25% of the female audience who don't have what you might regard as a regular cycle. And that's where our device is fitting in, if you like, the glue between the consumer, who perhaps has a regular cycle, and the clinic, where definitely most of the people that end up there for monitoring or in IVF, they will have some form of irregularity that needs to be detected by a device and then managed through therapeutic intervention.
Jump in, Susan.
Yeah, just building on that as well. I think one of the really important things is we all have lots of devices. I have my Fitbit, an Oura ring, whatever. It can become quite overwhelming. You've got like 5, 6, 7 different apps on your phone that you're having to open up to look at things. You've got some which is medically regulated, some or medical data, some that's consumer grade. I think it can be really difficult to interpret that. One thing I think that all companies should be doing, and I think it makes them far more valuable to investors in terms of that sort of competition versus cooperation, is building to interoperable standards so that it's really easy to pull data into a single place. Apple have their Health Kit. We've just launched Health Connect on the Android ecosystem. It'll be part of the operating system of all Android phones come October, so that you can, for participating organizations, all of that information can be surfaced in a single place, which I think, again, is something about giving individuals, whether that's women or men, the ability to interpret and use information in a valuable way, rather than having to think, oh, what's my glucose, and then come out of that, oh, how does that relate to my blood pressure, and go into another app, etc. I do think that interoperability is really critical.
Yeah, and kind of building on that, I think from a user's perspective, I think as a product manager, that's how I always I'm tuned in to think. It can be, I want to go into a platform where I have multiple different things available to me. It can be digital services, nutritional advice, I don't know, whatever type of products. But I think it's going to be about these platforms that bring in different kinds of products and services together that help solve problems for the end user. And to be honest, wearables, they're not going to be able to do everything. That's just a fact. We can't solve all the problems, and that would just be stupid business, for us in a way. So we want to be really focused. And for example, with your Rob product, this is something where we could complement each other. That would benefit the user, right? Because you take a much deeper dive than Oura Ring could ever do at this point. So there are these collaborative things we could do with different sorts of products. And I think if you think about the market, we all say that it's underserved. And there's not enough things and products and services for women solving these problems. So we shouldn't get stuck on the competition part, but we should rather be collaborating and building and together bringing these great solutions and platforms and ecosystems for the users, because this will help their lives and this will make a difference.
Well said. And I think we're approaching the end of the panel. I'm going to ask one final question. I'll call it a quick fire question. So quick question, quick answer. We've talked better regulations. We've talked about integrations. We've talked about, we didn't talk about AI. You mentioned AI. But what's next? What needs to happen next? Who wants to go first? We'll go left to right. How about that? Go, Mario.
On the spot, man. What happens next is for sure in the investors space. I think a huge mindset shift because we now have primary data and actual objective data available to also not only tell our investors subjectively how big of a market and how important that market is, but it's also as a fact it's proven. So that's on an investor side of things where we'll see money flowing in fast. The second is for sure on a product level. I think as the sooner the walled gardens are falling down, the faster also caretakers, practitioners and co will be taking up on that technology to enable their advice and their coaching and their prescriptions. Right? So we're going to see the shift of, I don't need to talk you through the impact of glucose for a consultation session of 1 hour because that information was already or is already available. So the quality time of spending with the doctor will be shifting towards actual care and not about education. And that's going to be a huge shift where the right people can focus on the right jobs again.
Kristina.
Well, maybe I'll continue from that because it's enabling this preventative care by data and having it long term. So you understand your body, your cycle, your patterns, your whatever from a longer period of time. So when you do encounter that professional, a healthcare provider, the conversation is somewhere else. It's already like solving the problem and getting to the value part more quicker.
Good. Mr. Rubb.
We start to diagnose the 50% of women who currently go undiagnosed. That's what needs to happen next. We're still back to where back to the future. We still need to do that first.
Can somebody tweet that?
Yes,
excellent.
Please, yeah.
And from my perspective, as a doctor by training, what I'd like to see is the healthcare profession start to accept the importance of these products in their patients' lives, right? And understand that the downstream benefits of prescribing them or letting people use them and give them the information, the system information from them far outweigh the cost of getting them in the here and now. And then what genuinely happens next is that one of my colleagues, I've been told I have to plug this, Dr. Vishal Varani, is doing a session in the Franks room on creating clinical content on YouTube, which, given that information is a determinant of health, and we all deserve really high quality health information, is going to be fantastic.
Excellent. Well, can we give a round of applause to our esteemed panelists?
Hi. I think this has been brushed on a little bit, but we're talking about empowerment of users. But if they go to a doctor, those doctors are being trained on diagnosis and symptoms that are based on a male body. So how are they supposed to know what the next steps will be given this sudden influx of a massive data for a particular woman?
I don't think that's quite true. We've not just been trained on, it's a long time since I did my medical training. And yes, many drug studies are done predominantly on men, et cetera, but it's not quite as black and white as that. I do think, and I think this is true, I have to say, for men and women, getting healthcare professionals to understand health information in a different that we're providing to them is the challenge, as opposed to kind of necessarily the next steps and sort of relating to what they've been trained in. I think that's the shift of the change in control and information that there is in that healthcare professional patient relationship. as opposed to specifically them not knowing what the next steps are, would be my response to that, I think.
We've been offering a clinician portal since 2020 to our app, and it's quite interesting. The uptake of, we previously offered the app to clinicians as well, so they could see the patient data. Nobody used it. Since we've started offering the clinician portal, there's been a much greater engagement. And that's partly because we're saying this is a product for you as well. And I think that, that glue, as I was talking about, is really important. This is a product for you as well, and here's what it means when this happens. So we're doing a bit of education, but we're not doing it in a patronizing way. We're providing the data so that they can understand it from a clinical point of view, rather than just from a user point of view.
Yeah, and from Aura's perspective, we got to fund the research, right? So that we get the right research, we get the right data sets, and that we can build algorithms designed, for example, for women, based on, data from all types of, all ages of women, and that's what we got to do, and that's what Oura is actually doing, because we didn't have many of it. We didn't have enough of it, so we decided, okay, we're going to start doing it ourselves. So I think that's also going to be a game changer, that tech companies will start doing it themselves so that they get the right data. But then there's that change management or change resistance thing that you still have to convince the doctors, and maybe, Rob, what you said, like, it's about how can we get the healthcare providers to embrace the data. Like, this is actually going to make your job easier, hopefully, because we all want to solve the problems here.
Just to very quickly add on that, it's a lot of burden that is on the startup side, double-sided, right? Not only to educate the consumer how to digest that information, but also doctors and clinicians. Main reason why we are also, on our platform we have dietitian consultations. So we specifically need to educate them about managing glucose and what it means, so that they are allowed to consult with our users. So yes, we need to take that double burden in order to make it work. That's as simple.